All right, continuing with chapter 4, we are on slide 25. So here we're looking at some diagnostic tests and some terms that go along with them. The first term on this slide, Doppler echocardiography. Doppler echocardiography and Doppler scanning are going to be the same thing. And these are both a use of ultrasound technology that are used to examine the heart. But for this type of scan, they are using different sound waves than in a normal ultrasound. Okay, so Doppler echocardiography and Doppler scanning are both ultrasound technologies used to examine the heart, but we're using a different form of sound waves than a normal ultrasound. Then we have cardiac MRI. This uses the magnetic radio frequency to create a picture. So we learned that MRI stands for magnetic resonance imaging. So this is using a big magnet to pull at the magnetic properties of our body to create a picture. Then we have computed tomography. This is a CT scan. This is going to be able to create a 3D picture. And specifically in this chapter, we'd be talking about a CT scan of the heart. So a 3D image of the heart. Then we have positron emission tomography, which is also known as a PET scan. And a PET scan is going to use gamma rays to create a picture. So the use of gamma rays to create a picture. Then we have echocardiography. This is a sonogram of the heart, or the process of sonogramming the heart. Okay, so this is the ultrasound of the heart. And the image that's created is an echocardiogram. Okay, so this is the picture created in the echocardiography process. So it's an ultrasound picture of the heart. Here we are looking at an example of echocardiography. So on our slide here, the arrows, well, picture A is showing you the process of an echocardiogram being taken, that ultrasound of the heart, and then B is showing you an image that can be created in an echocardiogram. The arrows in the image indicate the location of a large blood clot. Okay, so if you can see some arrows here, okay, it's showing you where there's a blood clot. You can also see the chambers of the heart, and they're labeled here in this picture. Okay, RV is right ventricle, LV left ventricle, RA right atrium, LA left atrium. Here we're looking at some more diagnostic test terms. The first one up there, arteriography. Okay, arteriography would be an X-ray of the arteries. To be able to get this type of image, we would need to inject the heart with a radio-opaque material. So this will be into the bloodstream, and this is what's going to make the arteries show up on the X-ray image. Okay, so arteriography would be the process of X-raying the arteries, and again, we need to use a radio-opaque material. An arteriograph would be then the instrument used to create the X-ray image of the arteries. And then the image itself would be an arteriogram. Okay, that's the picture that's created of the arteries. Then we get a little bit more specific, a coronary arteriography. Okay, this is going to be an X-ray image, or the process of X-raying the coronary arteries. So this is just getting more specific on what arteries we're looking at. Then we have aortography. Okay, aortography is arteriography of the aorta. Okay, so this would be the process of X-raying the aorta. Then we have an aortogram, okay, and that would be the X-ray image created in aortography. Our next term is DSA, digital subtraction angiography. Okay, this is going to provide a computer-enhanced X-ray image of blood vessels that are filled with a contrast medium, and that contrast medium is that radio opaque material that we talked about above. So DSA is a computer-enhanced X-ray image of blood vessels filled with that contrast medium. Then we have electrophysiologic studies. This is where they would use the electrode catheters to pace the heart and identify rhythm disturbances of the heart. So electrophysiologic studies is going to have the electrode catheters on the chest, and they're going to pace the heart and then identify any rhythm disturbances of the heart. Then we have cardiac catheterization. Cardiac catheterization is the passage of a long, flexible tube into the heart chambers through a vein in an arm or leg or the neck. Okay, so the passage of a long, flexible tube into the heart's chambers through a vein in an arm or a leg or the neck. This is going to allow for the collection of blood samples from different parts of the heart, and it's going to help determine pressure differences in the various chambers. And then the last chunk of terms is looking at vessels. So angio means vessel. So that first term, angiogram, would be the X-ray image of vessels, okay, because gram is the record produced. Angiography would be the process of X-raying vessels of any sort. And again, to be able to have an X-ray show up of the vessels, we would need a contrast medium. And then the last term just gets more specific. Angiocardiography would be the process of X-raying the heart's vessels. The heart's vessels. Here we're looking at an example of an arteriogram. Okay, so this is an X-ray image of an artery. Okay, again, this is after an injection of radio-opaque contrast medium. And you can see that arrow in the top left corner. That arrow indicates an atrial blockage. So this would be some kind of blockage in the artery that we're seeing with that arrow. Here we're looking at that process of cardiac catheterization. So picture A is showing you left-sided catheterization, and picture B is showing you right-sided catheterization. So to do this process, they would use endoscopic equipment. Okay, endoscopic would be an instrument used to view the inside of something. So they're going to use endoscopic equipment as a way to advance the catheter and see the internal visualization of the structures. The catheter enables the use of contrast medium that enhance our X-ray image of the heart and its vessels for angiography, like we talked about on the last slide or two, which will then produce an angiogram, or you could use it for angicardiography to specifically talk about those blood vessels. All right, so looking at our heart pathologies. Okay, so the leading cause of death in the United States is cardiovascular disease. Okay, so heart disease. Cardiovascular disease is any abnormal condition categorized by dysfunction of the heart and blood vessels. Okay, so anything you can do to improve your cardiovascular health will improve your quality of life and very possibly the length of your life. So things that we can do are stop smoking, start or continue to exercise if that's something you already practice, and eating a more well-balanced diet can all improve our heart health. So if we are looking at these heart pathologies, primary cardiac diseases are those that originate in the heart. Okay, so some of the examples that we're going to be talking about are structural defects, inflammation, and infections of the heart. So some examples of primary cardiac diseases would be atriomegaly. Okay, atriomegaly is going to be the enlargement of the atria. So the top half of the heart is enlarged. That's atriomegaly. Cardiomegaly would be enlargement of the heart as a whole. And microcardia would mean abnormal smallness or condition of smallness of the heart. Then we have congenital heart disease and congenital heart defects. Okay, if you remember, congenital means present at birth. Okay, so congenital heart disease would be an illness of the heart that the baby is born with, and a congenital heart defect would be a defect in the heart that the baby is born with. So murmurs, okay, heart murmurs, what we see there next are abnormal heart sounds. Abnormal heart sounds or murmurs have many causes, but one of the most common causes of a heart murmur is a congenital heart defect. So, for instance, if you've ever heard of somebody saying they were born with a hole in their heart, okay, that could cause a heart murmur, and that would be an example of a congenital heart defect. Cyanosis. Cyanosis is a term that we've had already. Cyanosis means that abnormal blue discoloration of something. And this is a sign of a heart problem because when there's discoloration of the skin and the mucous membranes, turning it that bluish color, that can be a sign that there's an insufficient amount of oxygen getting to our tissues. Here we are looking at ventricular septal defect. Okay, ventricular septal defect is the abnormal opening in the septal wall, so that wall that divides the heart into right and left halves. There's an abnormal opening in the septal wall that divides the left and right ventricles in this case, and it's indicated by the yellow arrow. Okay, so you can see this yellow arrow right here. There's a hole between those. The direction of abnormal blood flow, so left to right or right to left, then depends on the stage of the septal defect. And what's going to happen when something like this has occurred? There's going to be a dilution of oxygenated blood, which is going to result in cyanosis, or that bluish discoloration of the skin, because some of that deoxygenated blood from the right side of the heart is mixing with the oxygenated blood on the left side of the heart, okay, causing this blood then that's getting sent out to the body via the aorta to be less oxygenated. There'll be less oxygen within that blood going out to the body.